Hi, we're here with Becky today. Becky came to us with right knee pain. She'd had a lot of degeneration in her knee and a lot of swelling. I'm not going to take away from her describing what she was feeling. So could you tell us a little bit about the problems you were having when you first came in and the limitations you had?
Well, I came in with right knee pain, a lot of swelling, a lot of difficulty walking, couldn't go up and down steps normally, trouble getting up and down from a sitting position. And since being here, I've had quite a bit of improvement. I'm able to get out and do yard work and go up and down steps normally, and the swelling's gone down quite a bit. I walk much more easily now. Don't seem to be giving in to that knee like I did before. Kind of favored that knee a lot, but I've seen quite a bit of improvement, and I'm real thankful. My husband suggested for me to come in and that I listened to him. Thankful for you and the girls that have helped me so much. It's been a great improvement. I feel like a different person, actually.
Well, it's been a pleasure to help you. We use the knee decompression, the Hockamed and the PMF to help with the pain and to heal the tissue. And you were limping quite a lot when you first came, and that's gone now, pretty much.
Well, my doctor had said that when my knee got to the point that I was having such severe pain or problems walking, he would try to inject it first and then refer me to orthopedic. And I wanted to avoid surgery at all, just avoid surgery if at all possible.
Absolutely.
And I feel like this has been a great help, and I'm not even thinking about surgery right now. So.
Well, you're doing so well, and now that it's springtime, you can get to enjoy yourself and not be in pain and struggle. Well, thank you so much for helping us and for sharing your story with others.
I appreciate your helping me, and I'll be coming back from time to time to see how y'all are doing.
That's right, and to keep it maintained for you, because her joint was very, very thin with the spacing in there, and we were able to get some of that back. But another really great side benefit was her posture changed significantly, because she was really leaning and giving into it, even leaning forward as well as to the side. So that's going to save you a lot of spinal problems later on.
That's good.
Too.
Well, I appreciate it.
Thank you.
Thank you.